Hello there. I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. Today's health topic is important to me both personally and professionally, as many members of my family and patients experience it, and that's high blood pressure or hypertension. May is National High Blood Pressure Education Month. Hypertension is called the silent disease because it's linked to several leading causes of death, including heart attacks, stroke, and kidney disease. But the scary thing is that most people with high blood pressure don't know they even have it. In today's show, I'll share 6 facts about high blood pressure that may surprise you. The first, young people can get hypertension. Many people associate high blood pressure or hypertension with old people. Not true. According to the CDC, nearly 25% of people aged 20 to 44 have hypertension, which is the primary cause of stroke, which is rising among younger people. Health experts think the increased risk for stroke in this age group is related to an increase in obesity, high blood pressure, and type 2 diabetes, conditions, by the way, that are preventable and treatable. So get your blood pressure checked at your doctor's office or pharmacy or at home using a home blood pressure monitor. Children and teenagers can also get high blood pressure, likely related to an increase in childhood obesity. Second fact that may surprise you. Hypertension often doesn't have any symptoms. Most people with high blood pressure don't know they even have it. This probably explains why, among half the US adults who have hypertension, only 1/4 of them have it under control. This is why everyone needs to see their doctor every year to check blood pressure, cholesterol, and hemoglobin A1C, as well as other preventive care like mammograms, colonoscopies, and vaccinations. Third fact, hypertension may be associated with dementia. Studies published by Johns Hopkins found a connection between high blood pressure and an increased risk for dementia, which is a loss of cognitive function. Researchers found that older people with hypertension were more likely to have biomarkers for Alzheimer's disease in their spinal fluid. So, how are these two conditions related? Well, high blood pressure can damage small blood vessels in the brain that affect thinking, memory, and reasoning. But here's some good news. Research published in the journal Neurology found that potassium-sparing diuretics, which is a common class of blood pressure medications, reduce the risk of Alzheimer's disease nearly 75%. And for any other antihypertensive medication, the risk dropped by a third. So, another reason to get your blood pressure under control. The fourth fact that may surprise you, women and Black Americans are uniquely affected by hypertension. Women with high blood pressure have higher risk of complications during pregnancy. And women who develop preeclampsia, which is high blood pressure, swelling of the hands and feet, and protein in the urine during pregnancy, are at higher risk of developing hypertension later in life. Some birth control medications can also increase risk for hypertension. So, what about Black Americans? The American Heart Association reports that high blood pressure is more prevalent among Black people than any other racial group. About 55% of Black adults have high blood pressure. They also have severe hypertension and they develop it earlier in life. So, why is this? Historic and systemic factors play a major role, including social determinants of health, such as lack of access to healthcare and lack of access to healthy foods. Higher rates of diabetes and obesity among Black people are also related to hypertension, and mistrust of the medical community based on decades of discrimination impairs access to care, leading to delayed diagnosis and treatment. A fourth fact that may surprise you: what you can eat can affect your blood pressure. Too much sodium can increase blood pressure by causing water retention, which puts increased pressure on your heart and blood vessels. And it's not processed foods and snacks such as breads and luncheon meats, soups, pizza, hamburgers, and chips all have loads of sodium. So be a smart shopper and read food labels. People with hypertension and those at high risk for developing hypertension, including adults over age 50 and Black adults, should have no more than 1,500 milligrams of sodium daily. That's less than 3/4 of a teaspoon. And for everyone else, 2,300 milligrams of sodium per day, that's about 1 teaspoon of sodium, salt per day, should really be the max. A study in the New England Journal of Medicine showed that cutting down salt by just half a teaspoon per day could reduce the number of new heart disease cases by up to 120,000 per year. By the way, if you're like me and you can't eat bland food, I have great news. Use flavorful and healthy spices, also salt alternatives, such spices and herbs like black pepper, garlic, cumin, coriander, cayenne, and red pepper chili flakes. It'll make your food taste so good. All right, sixth and final fact that may surprise you. Certain medicines can affect your blood pressure. Some pain and inflammatory medicines like ibuprofen, indomethacin, and aspirin can cause water retention and increase blood pressure. Cold medicines or decongestants like pseudoephedrine or Sudafed and phenylephrine narrow blood vessels and increase blood pressure. Several antidepressants can also increase blood pressure, including SSRIs like fluoxetine or Prozac and tricyclic antidepressants such as amitriptyline. Stimulants such as methylphenidate or Ritalin can also increase your heart rate and then increase your blood pressure. Hormonal birth control pills and devices can also narrow blood vessels and cause high blood pressure. If you take any of these medicines, or if you're unsure of the medicines you currently take, talk to your doctor and check your blood pressure regularly. I should also note that alcohol, tobacco, and many illicit drugs such as cocaine, methamphetamine, anabolic steroids, and MDMA or ecstasy can all increase your blood pressure and cause damage to your heart. The great news is that hypertension can be prevented. A healthy meal plan that's rich in fruits, vegetables, whole grains, low dairy, and low on saturated fats can lower your blood pressure. This is known as the DASH diet, or dietary approaches to stop hypertension. Regular physical activity can also prevent hypertension, as well as quitting smoking and moderate amounts of alcohol. If you do develop high blood pressure, there are many different classes of medications that can effectively treat it, including diuretics such as hydrochlorothiazide, ACE inhibitors like lisinopril, calcium channel blockers such as amlodipine, and many others. Well, folks, that's all for today. And here's your joke of the day hypertension theme. Why did the skeptic have high blood pressure? He took everything with a grain of salt. Well, folks, have a great weekend. I'll see you on Monday, 3 o'clock Eastern. In the meantime, be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony, Dr. Roy. Be well. I'll see you soon.